Why awareness, not biology, becomes morally decisive. At some point in bioethics, the question shifts. It stops being, "What are you?" and becomes, "Are you there?" Not biologically alive, not genetically human, but consciously present. This shift marks the move into what bioethicists call consciousness-based theory. Its core claim is simple but unsettling. Moral status depends on conscious awareness, not mere biological life. According to this view, being alive is not enough. To matter morally, a being must be aware in some meaningful sense. This theory begins with a challenge to biological thinking. If a body is alive, but there is no awareness, no experience, no subjectivity, no point of view, then who exactly is being harmed? Consciousness-based theorists argue that moral concern only makes sense where there is someone there to experience it. No awareness, no experience, no moral subject. This approach places consciousness, not species, at the center of ethics, and immediately the terrain changes. The morally relevant question is no longer, is this a human being? But, is there conscious awareness happening here? To answer that, the theory draws on distinctions from philosophy of mind and neuroscience. Consciousness is not a single thing. There are variants. One is wakeful consciousness. This is the most familiar sense. Being awake rather than asleep. Responsive rather than unresponsive. Able to interact with the environment. A patient who opens their eyes, follows commands, or tracks movement is taken to be consciously present. Wakefulness is often the first marker clinicians look for. Another is phenomenal consciousness. This is deeper. It refers to the felt quality of experience, what philosophers call what it is like to be a being, what it feels like to feel pain, to hear a sound, to see light, to experience fear, comfort, or confusion. Phenomenal consciousness is subjective by definition. It cannot be observed directly. It must be inferred. But for many philosophers, this is the core of moral relevance. If there is something it is like to be you, then you matter morally. A third variant is access consciousness. This refers to whether information is available for reasoning, decision-making, and action. Can the being use information, integrate it, act upon it? This version of consciousness matters especially in discussions of autonomy, agency, and responsibility. But it is more demanding and more exclusive. Together, these variants shape how consciousness-based theory is applied. Different thinkers emphasize different forms, but all agree on one point: without awareness, moral status collapses. One of the strengths of this theory is that it connects ethics directly to lived experience. Morality, on this view, is not about abstract categories. It is about experience from the inside. Pain matters because it is felt. Fear matters because it is experienced. Pleasure matters because it is enjoyed. If there is no experience, then there is no one for morality to address. This makes consciousness-based ethics feel deeply intuitive, especially in clinical contexts. This is why the theory plays such a prominent role in coma, anesthesia, and brain death debates. Consider anesthesia. We accept invasive surgery under anesthesia precisely because consciousness is absent. The body is harmed in one sense, but the person is not experiencing it. Or consider coma. If consciousness is expected to return, many argue that moral status remains. But if awareness is permanently absent, the moral picture becomes far more complex. Nowhere is this more evident than in debates over brain death. When the brain irreversibly loses the capacity for consciousness, many ethicists argue that the person, the conscious subject, is gone. What remains is biological life without personal presence. From this perspective, continuing life support does not preserve a person, it preserves a body. This reasoning has shaped modern medical criteria for death in many countries. The theory also has real traction in neuroethics. As neuroscience advances, we are forced to ask, What level of awareness is enough? Can minimal consciousness ground moral status? What about locked in syndrome, vegetative states, minimally conscious states? Consciousness based theory pushes ethics into direct conversation with brain science. But the theory has serious weaknesses, and its most troubling implication is this: it risks excluding temporarily unconscious humans from moral status. If awareness is the sole criterion, then people in dreamless sleep patients under anesthesia, individuals with reversible coma would, strictly speaking, lack moral standing, at least temporarily. Most people find this conclusion unacceptable. To avoid it, theorists often appeal to potential or prior consciousness. But the moment they do, the theory begins to borrow from other frameworks. Another problem is definitional. Consciousness is notoriously difficult to define and detect. We cannot measure it directly. We infer it from behavior, brain activity, and reports. But these indicators can conflict. A patient may show brain activity without responsiveness. Another may be responsive without clear signs of awareness. This uncertainty creates ethical instability. If moral status depends on something we cannot reliably identify, decisions become fragile and potentially dangerous. There is also a deeper philosophical worry. If moral status depends entirely on consciousness, then value becomes episodic. A being matters morally when conscious and does not when unconscious. For many critics, this undermines the idea of enduring human worth. It makes moral status flicker on and off with neural states. And yet, despite these critiques, consciousness based theory remains deeply influential because it captures something morally compelling. Ethics is about someone, not something, about experience, not just existence. It forces us to confront the uncomfortable possibility that biological life and personal presence are not the same thing. Most contemporary bioethics does not rely on consciousness alone, but it cannot ignore it either. Even theories grounded in dignity, rights, or species membership still ask, is the person aware? Can they experience harm? Is there someone left to suffer? So, consciousness based theory leaves us with a question that haunts modern medicine. When awareness disappears, what, if anything, remains morally present? That question sits at the heart of end of life care, neuroethics, and debates about death itself, and it is one bioethics cannot afford to avoid.